Anytime someone as famous as Elizabeth Taylor dies of a disorder or disease like that, we want to learn more about it. It's under the microscope. So what is congestive heart failure?
Well, you know, the term congestive heart failure, it makes it sound like your heart has completely stopped beating, and that's not quite right. But it does mean that your heart is in a weakened state and it's not able to pump as effectively as it should. So the heart's job is to pump blood and nutrients throughout the body. And if you're in heart failure, then your body is just not able to compensate enough because your heart's
the heart
weak.
In a sense is pumping so hard, but the nutrients and oxygen
well, it's just not able to pump hard enough to help the body do all the things it needs.
What are some of the symptoms of congestive heart failure?
Some of the symptoms are difficulty breathing. It's difficult to catch your breath. Also swelling. Since your heart is not pumping and circulating well, then your kidneys are not able to filter that blood and get the fluid out. So a lot of times people have swelling in their feet, in their legs, or even around their lungs, and that makes it harder for them to breathe. Even impaired thinking or confusion, because if sodium starts building up in your blood, that can cause confusion. So maybe if you have one of those symptoms, it's not something to worry about, but if you have a couple of them, or if they're persistent, you really need to talk to your doctor.
You have several of them.
Yeah.
Well, those are the symptoms. What causes it?
Well, again, it's not that you have a heart attack, it's not that your heart completely stops beating, but over time, or if you have some kind of defect, then your heart is just in a weakened condition and you aren't able to do all the things you used to do.
And these are some of the preventive things and treatment here. So what should people be doing?
Lifestyle changes are huge for congestive heart failure. Quit smoking, lose some weight, or maintain your weight if you're already at a healthy weight. Your doctor might tell you to limit your fluid intake because you're having trouble getting rid of some of that fluid. Again, that's between you and your doctor. Avoid alcohol and caffeine. Those are really hard on your heart. And eat a heart-healthy diet. Lower your fat, your saturated fat, your cholesterol. Lower your sodium. Those are all smart things.
So it is preventable and treatable if caught early.
A lot of people live very healthy or very happy lives with congestive heart failure, but it is a chronic condition. It is serious.
All right. Thanks, Nellie, for telling us more about this. For more information about heart disease, go to our website, k2l.com, and look for websites mentioned on air.